Here in Nottinghamshire, we are part of an integrated care system. Acute trusts, mental health organisations, community services, primary care, the community voluntary sector. We've come together collectively, putting organisational boundaries behind us to work together for the benefit of our local population. So when we heard about QSIR, it became evident that that was something that would really help us on that journey.
It provided a range of tools that were an offer for education, but we also saw the potential in bringing organisations together under that umbrella.
QSIR was there to make sure that we had a single methodology for implementing change that was very inclusive with staff, with local people, and that would enable us to improve change in a sustainable way.
So the demand is all the requests for a service that come in from all different sources. So
the more we learn together, the more that we will work together as a system. That was the objective right from the beginning. Seeing projects across the whole of the system rather than just in silo organisations. That was the whole philosophy.
One of the key areas we're focused on is urgent and emergency care, which is one of the biggest challenges, one of the biggest priorities for the system, like many systems nationally.
So the emergency pathways transformation is about improving outcomes for patients. That's at the centre of it. We really had a very difficult winter last year, which nobody wants to repeat. So this project is about trying to standardise and simplify the emergency care pathways. This is about standardising the care that our patients get and being able to understand when it's not being delivered in the way that we would want it to be, and having the data behind that to really hone in and understand where the problems are to improve things. It does span the entire system in terms of we're working with the ambulance service, community partners, primary care. I think what QSIR's given me is it's allowed me to really look at how you do plan and follow a proper process in terms of improvement work. I think some of the projects where I've not done so well in the past is because we've always got the evaluation wrong and we've not been able to demonstrate improvement with robust data. What we're really trying to embed in this project is real data analysis and being able to understand the processes that make up different pathways, and then understand what data sits behind that so that we can really use it to really understand where the problems are. I think QSIR has given me the confidence to challenge colleagues around the approaches we possibly might have taken to doing projects and improvement projects especially, and I think really in a nutshell it's about understanding what improvement is and not just doing change for change's sake.
We're also working on joint projects with mental health, outpatients, shared governance. The whole ethos of QSIR is to ensure that change is targeted, it's beneficial, but also that it's sustainable. And to do that, it needs to become normal business. That's the normal way of doing things throughout the Nottinghamshire system.
I'm very lucky. I have gone from the ward to the board and been an executive director for a long time, and it is so important as an organisation, as a hospital, as an integrated healthcare system, that improvement is led from the board.
I am really passionate.
I strongly believe in Nottinghamshire we have that every board director, every trust board, every chief exec endorses and supports this. And with that, I think we've got the ability then to ensure that we influence all members of our staff the importance of improvement. And if you've got that, you've got the golden nugget what delivers exceptional care to patients and families.
Over the past 5 days, which has been spread out over about 3 months, we've brought together just under 50 people from the emergency pathway or connected to that pathway from our various organisations across Nottinghamshire.
Did extra capacity actually solve the problem?
The 5 modules that are delivered are comprehensive, they're full days. They are based on a combination of training and teaching, but I guess the richness comes from the networking in the room and the interaction on the tables.
One of the best things about QSIR is it's not exclusive. It's for everybody. It's for all different roles, all different parts of the system.
It's growing, and I think what's fundamentally such a joy about the QSIR programme and the QSIR Associates is we're a real mix of people. We've come from very different backgrounds, we've got very different roles. We bring very many different things to enrich the QSIR programme.
We started with 5 QSIR Associates in 2017. In 2018 we now have 12 QSIR Associates. In order to deliver a sustainable programme across the Nottinghamshire ICS, we estimate that we're going to need 20 QSIR Associates permanently. So due to attrition rates and people leaving and moving on to other things, we need to maintain that level. So we're looking to train a further 2 to 4 QSIR Associates each year to maintain and sustain our programme.
Our plan going forward is to train a much larger number of people in QI methodology. I think what that is saying is that we value the quality improvement offer. The model is good, it has enough flexibility, and we now have the capacity to train people at a large scale.
So one of the things we're very clear about when we embarked on QSIR was to make sure that we develop the skills of our local staff, but also that this is about the benefit to patients, carers, citizens.
So you've done your fundamentals training as a patient representative.
Yeah.
What did you think of it?
I thought it was really good. It was quite.
We've been involving patients in improvement for a long time, but what's different now is we're involving patients in the training programmes, the same training programmes that we are providing for our staff.
You see the patient professionally, the carer sees the patient emotionally.
For shared governance, when we're looking at projects for improvement, it's really vital to have people like Trevor in the room. When we do the training together, we're going on the same journey. We need to be talking the same language and understand the same process.
The benefits of having patients involved in the process is they have the insight, so they've actually sort of lived the pathway, if you like, which enables us then to really co-design improvement for patients, by patients, collaboratively.
One of the key things of making this work is there is the right level of support and administration to make that happen.
My role really is to coordinate all the programs that happen across Nottinghamshire ICS, and a lot of my work is focused on ensuring that we can evidently see all the work that's being done. If we need the evidence, it needs to be measurable. Morning. At the moment, we're currently trying to build a wider ICS knowledge-based system, not just in-house, where we collate case studies of projects that are being undertaken, and this knowledge-based system will be used across the ICS. We can show all the projects that have been success. It takes a long time to get everything in place. It takes a lot of dedication, collaborative working. It takes a lot of communications between people. It takes a lot of understanding, because we have to appreciate the fact that it's different people coming from different backgrounds. We're having our next associates meeting next week Thursday. It takes effort and dedication, but once you have it in a set system, it becomes fluid. Everything just comes together.
Daniel, excel.
Attending the graduation ceremony today was absolutely fabulous. When you're actually a patient, you don't know the difference to organisational boundaries. You want fantastic quality of care, you want best outcome. And what I felt today was a real spirit from lots of people from different organisations across Nottinghamshire, understanding that and wanting to make that difference, so it's absolutely fantastic.
You can all go out there now and do it.
On graduation day, there's a lot of life, a lot of, I don't know if I should say love, but there's a sense of achievement.
Thank you.
Our vision for the future is that QSIR becomes the normal way that we do business across Nottinghamshire. It's embedded not only in our strategy, but it's embedded in everything that we're doing. It's the approach that we take through any kind of change, and really embodies how we want to make change happen in the future of Nottinghamshire.